as you know yourself, you've done some of our studies, it should be difficult. So that's kind of the key one. It's making sure you individualize the pressure. And then related to that, it's the device that you use. If someone's tying a TheraBand around their limb or a bicycle inner tube, you have no idea what pressure you're applying.
Yeah.
And also, for me, you cannot be consistent with that pressure across sessions. You can't say, oh, this is how tight it was last time. Because again, multifactorial, multiple things can influence that. So using a device where you can actually A, see the pressure, but B, also a device that's designed to regulate the pressure. And the reason I say that is because one of my first PhD studies, we looked at different types of BFR devices that were on the market at the time. Now, this was 2017 when we did this, so there was significantly less devices available at the time. But we had three different types, and we had a handheld pump, like blood pressure sphig type device. We had a surgical tourniquet, which is designed to regulate pressure. And then we had like a Hulkinson device, which is a rapid inflation cuff. And we developed this system where we put pressure sensors between the cuff and the limb and actually measured what was happening, the interface pressure between the cuff and the limb, because it was evident to me that in the papers, people were saying, right, we applied 150 millimeters of mercury. It's like, okay, but do we actually know that's what the limb's subjected to? Like, some of these cuffs are thick, some are thin, some are wide, narrow. How well is that pressure being, transmitted to the tissues? And essentially what we found is that in a cuff that isn't designed to regulate pressure, we saw big spikes in the superficial tissue pressure. So if you think, for example, we tie a TheraBand around your arm that's not designed to change, and then we get concentric muscle action, and the muscle gets shorter and fatter, and it pushes up against that cuff, it actually exposes the tissue to a greater pressure and a greater pressure gradient. And what we found is that cuffs that weren't designed to regulate, that would happen. So we could see almost like 50% more of the pressure that was set being applied. And this was resulting in more discomfort, higher pain scores, a greater hemodynamic response. Whereas in a cuff that was designed to regulate and adapt to changes in movement, the pressure changes were smaller, and then the perceptual and hemodynamic responses were less. So I would also advise to use a device that is designed to do that.